Good evening, guys. I've got discussion B for you. Here's a deeper dive into the 12 lifestyle habits for long-term kidney health, as outlined in the FODMAP Everyday article, with added contexts, clinical relevance, and ideas for adaptation into culturally responsive frameworks. Okay, your kidneys are silent workhorses, each about the size of a fist, yet responsible for filtering 200 liters of blood every day or daily. They regulate fluid balance, blood pressure, bone metabolism, and waste elimination. Despite their vital role, kidney disease often progresses unnoticed until advanced stages, with 14% of the U.S. adults affected by chronic kidney disease, or CKD for short, and projections placing CKD as the fifth leading global cause of years of life lost. By 2040, prevention is no longer optional, it's urgent. Dr. Charles Zachman, a kidney care leader, emphasizes that prevention actions at home are essential to kidney long-term resilience. As the newest medical breakthroughs, these 12 habits are not just tips, they're proactive strategies that can be adapted for across cultures, communities, and care models. 12 lifestyle habits for kidney resilience. Regular exercise impact reduces blood pressure, improves insulin sensitivity, and lowers CKD risk by up to 40%. Evidence meta-analysis shows each additional 10 met hours week of activity reduces CKD risk by 2%. Action aim for 150 minutes per week of moderate movement, walking, dancing, gardening, all count. Adaptation tip: enroll or low resource settings. Promote culturally familiar activities like community walking groups or dancing traditions. Maintain a healthy weight. Why it matters: obesity increases risk for diabetes and hypertension, two leading causes of kidney damage. Focus on sustainable changes, portion control, whole foods, and rejecting crash diets. Toolkit idea: virtual portion guides and culturally tailored meal planning resources can support diverse communities. Eat a balanced, kidney friendly diet. Guidelines: embrace the DASH diet, rich in fruits, vegetables, whole grains, and low fat dairy. Avoid processed foods, excess sodium, and red meat. Quick hack: shop the shop the perimeter of the grocery store where fresh foods are live. Cultural adaptation: translate DASH principles into traditional cuisines, e.g., plant-based soul food, low sodium Asian dishes. Stay hydrated. Function: water supports toxin elimination and prevents kidney stones. Target: 1.5 2 liters a day, 6 to 8 cups more if active or in hot climates. Caution: individuals with CKD or on dialysis should consult providers before adjusting fluid intake. Community tip: use urine color charts in outreach materials to teach hydration clues. Limit alcohol risk. Excess alcohol raises blood pressure and dehydrates the body, straining the kidneys. Safe limits: men max 2 drinks per day. Women one drink a day. Toolkit inclusion: include harm reduction messaging and culturally sensitive alcohol education. Okay, next page. 1 second. Quit smoking. Smoking reduces kidney blood flow and increases cancer risk. Benefit: kidney function begins improving within weeks of quitting. Support: professionals, accession programs, quadruple access success rates. Outreach strategy: pair smoking cessation with kidney health education and community clinics. Manage blood pressure. Target below 130/80 mmHg. Methods: reduce sodium, exercise, monitor at home, take prescribed medications. Equity lens: provide free or subsidized home BP monitors, in underserved areas. Control blood sugar. Connection. Diabetes causes 40% of new CKD cases globally. Action. Monitor glucose. Take medications. Reduce added sugars. Toolkit feature. Include culturally adapted diabetes prevention resources with kidney health messaging. Regular checkups. Why CKD is often symptomatic until advanced stages. Tests. Blood pressure. CMP, EGFR, UACR. Frequently, annually, or every 3 to 6 months for high risk groups. Implementation. Mobile clinics and community health workers can bridge access gaps. Proper medication use. Warning: NSAIDs, ibuprofen, naproxen can impair kidney function. Advice: use only when necessary. Follow dosing. Ask about kidney safe alternatives. Toolkit addition. Include medication safety guides for caregivers and elders. Stress management impact. Chronic stress elevates blood pressure and cortisol, straining kidneys. Techniques: meditation, deep breathing, nature walks. Cultural integration. Incorporate spiritual or ancestral practices into stress reduction models. Adequate sleep. Goal: 7 to 9 hours of restorative sleep. Benefits: supports hormonal balances, blood pressure regulation, and kidney repair. Barrier reduction addresses sleep, hygiene, and caregiver toolkits and elder with wellness programs. Ready to co-design, these habits offer a powerful foundation for kidney health, but their impact multiplies when adapted to real world context, whether you're building caregiver toolkit or rural outreach programs or culturally responsive aging interventions. We can translate these insights into actionable, equity driven resources. Want to explore how these habits intersect with menopause infrastructure? Okay. Last one: gaps or integrational trauma informed care. Let's build something transformative together. Okay, guys, so that is B for you.